Good day. I'm here with Tom Recore, Dr. Recore, who's the chief resident of all of Duke Psychiatry. To be in your greatness is in and of itself a treat.
Thank you, Alex.
Thank you for allowing me to ask questions to you. And nice socks.
Thank you.
Who's your sock guy?
I don't have a sock guy.
That's your first mistake. We'll work on it later. One of the best memories I have of Tom was when I was working in the ER with him. And I didn't expect anybody to be on call with me. I just was, second-year resident, fresh out the blocks of first year, going in to work my shift. And Tom shows up and says, "Hey, buddy." And I'm like, "What are you doing here?" And he's like, "I'm going to be on with you." I was like, "Is this new?" And he was like, "Yeah, it's a new thing I'm starting that with the second-year residents, we're there for just a few hours so that, we just have your back." Right? And that, I think, really speaks to Tom as a person.
I remember the hand motion, too.
Yeah, you like that?
I did it, yeah.
It hurt. So, Tom, you have a lot of goals as chief resident, and a lot of them have to do with improving patient care and engaging us in improving patient care. Can you touch on what is your vision for what you'd like to see done over the next year?
In thinking about where I can be most helpful, I think probably some of the stuff I learned about developing esprit de corps, like from my Marine Corps days, is most helpful, and really thinking about ways to make the program one that I would want to come into again if I were a candidate for the program. And so some of the ways that I think we can make that happen is like you were talking about changes in the emergency room. There's this model in medical education that often the least trained physicians will see the most complicated patients, and sometimes with only moderate supervision. And I think, especially in the first couple years, it's most helpful to get early residents working in a team with some of the senior residents in this way to not only facilitate better education, but also to make it more of a family mentorship type program.
That's wonderful. These are wonderful goals, and I mean, in your 4 years here, I'm sure you've seen things change. It's a very dynamic department. Can you kind of touch on that? What's it like having started here, now a fourth-year resident?
Sure. So I came into the program knowing I wanted a rigorous program, and I think people are mistaken if they imagine that they can not see a lot of patients and still come out of a residency program really excellent, still an excellent clinician. Right? And so we've been able to maintain that in the last 4 years while still moving towards this model that I was talking about earlier, where it's a team model where people feel supported by not only other residents but also attendings.
So Tom, you're now on the cusp of graduating after having excellent training here at Duke, and I wonder, what are your career options like moving forward?
Sure. I'm going to be doing a forensics fellowship next year. Before I arrived at Duke, I took a contract with a state hospital in Mississippi. Specifically, I was able to get that contract, I think, in no small part because I was matching at Duke. But the plan is once I finish my forensics fellowship, I'll return to Jackson, Mississippi, and be doing criminal forensic evaluations for the state.
That's great. And it seems like our residents coming out of the program, in terms of their fellowship, they're having excellent choices.
Sure. I mean, when you go to the annual meetings, whether it's at the American Academy of Psychiatry and the law meetings, or you go to the APA meetings, folks recognize that Duke is a major player in psychiatric education.